Your child's just been diagnosed with scoliosis. You're nervous and concerned. I know how you feel. I've been there. Hi, I'm Dr. Marc Moramarco, and finding a way to help my daughter avoid scoliosis spinal surgery changed the course of my life. So what is scoliosis? Scoliosis is typically thought of as a simple lateral bending or side bending of the spine, when in fact it's a three-dimensional condition of the spine and rib cage. So let's discuss the three dimensions of scoliosis. In the first dimension or plane, it's known as the sagittal plane, looking at the patient from the side. The second plane is the frontal plane, looking at the patient from front to back or back to front. And the third plane is the transverse or rotational plane. This is where the vertebra can twist or rotate. The sagittal plane, looking at the patient from the side. Here's the head and the pelvis. There are four natural physiologic curves of the spine. In scoliosis, typically what we see is flattening of the thoracic and or lumbar spine. When this occurs, instabilities of the spine occur, and it can affect the other two planes. The frontal plane is looking at the patient from front to back. That's when looking at an x-ray and where the Cobb angle is measured, that's the frontal plane. People often say, my child has one curve, or my child has two curves, or an S-curve, when in fact there are typically 3 or 4 curves, because there are compensatory curves that develop above and below the main scoliotic curve. And the third plane is the rotation plane or transverse plane. This is where the vertebra can twist or rotate. As a result of this twisting or rotating, the rib cage can be pulled back on one side and pulled forward on the other. This creates postural asymmetries. We may see the shoulders, the rib cage, the pelvis. We may see rotation in these areas. In addition, these postural asymmetries can cause malalignment of the spine and rib cage. We may see unlevel shoulders, the rib cage more prominent, the pelvis more prominent, a hip shift. Also, this is more noticeable when the patient goes into what we call the forward bending test. The patient bends forward and we look behind them and we look for asymmetries or rotation. One side of the rib cage may be higher than the other. There are many types of scoliosis. 80 to 90% of scoliosis is known as idiopathic scoliosis or of unknown origin. It's predominantly in females and is classified according to the age of onset. Infantile scoliosis is diagnosed from birth to age 3. Juvenile scoliosis is diagnosed from age 3 to age 9. Adolescent idiopathic scoliosis, the most common type of scoliosis, is diagnosed from age 10 through skeletal maturity. In adults, scoliosis can be a continuation of their diagnosed scoliosis as an adolescent, juvenile, or infantile, or it can be a result of spinal degeneration. There are other types of scoliosis: congenital, neuromuscular, and scoliosis of other origins. I want you to know that there is hope for scoliosis, and taking a proactive approach can be very helpful. In future videos, I will discuss effective non-surgical scoliosis treatment approaches here at Scoliosis 3DC. Feel free to go to our website, scoliosis3dc.com, or give us a call. Thanks for watching.